Hi, it's Dr. White coming to you, the nursing professor. I know it's time for preparation for midterms, so I want to give you 6 steps to success. Now, these steps go way beyond memorization because memorization doesn't work. Definitely not for a midterm or a final because you have too many questions. All right, so these are some things I want you to remember. You remember we talked about the nursing process and how vital that was to you being able to have the answer for questions that you don't know the answer to. So if you remember the steps of the nursing process, it started out with assessment. And assessment was you gathering, collecting data, collecting information from your patient. And that information can be both subjective and objective. Remember, objective information is concrete information that you get, like your vital signs, like lab tests, things like that. Whereas subjective information is coming to you directly from your patient or from a family member who could possibly tell you something about the symptoms that your patient is experiencing. So that was the first step of the nursing process. And as a recall, let's go to the second step. That is diagnosis. And that diagnosis, if you remember, was a nursing diagnosis. And so you have a list of all those NANDA diagnoses that you can find in your nursing care plan book or your nursing diagnosis book. And that's taking all of that data, putting it together and coming up with something. An example would be this. Person comes to you, they complain of pain. If they have pain anywhere on their body, a nursing diagnosis associated with that would be alteration in comfort, because that is where your focus needs to be on, which means that could mean administering medications, it could mean repositioning your patient, it could mean giving them things like heat or ice or any of those other things that may help relieve some of those symptoms that they may be experiencing. All right, so we did assessment, we did diagnosis, and now we're coming up with a plan. Remember that plan must always include your patient. It can't be just your plan, because if it's just your plan, it's not gonna work. You know, you think about all the TV shows, you think about one of my guilty pleasures are My 600-Pound Life. That doctor comes up with a plan for these people to lose 500 pounds in 5 days. Impossible. That it can't be done. And many times you'll see that when they come back to see the doctor, they haven't lost any weight because the plan is not effective. It's not really a plan that they can manage themselves. So our plan needs to make certain that we're taking the patient's lifestyle in consideration when we're coming up with a plan that could be useful to them to help them in their health journey. The next step is intervention. Those are our actions. That, again, could be administering medications, it could be heat, cold, physical therapy, could be repositioning your patient. Many times people are uncomfortable because they can't position themselves in the bed. Maybe they have some mobility problems and they need help with that. So those are things that we can do to help facilitate their comfort. And then the last step, of course, will be evaluation, because we must evaluate whether or not our plan was effective or not. If it wasn't effective, we got to go back to the beginning and reassess things so that we can come up with something that may be effective for our patient. So using the nursing process is one of the first steps that we're going to use as far as studying in order for success in our midterm. The next step is looking at analyzing and recognizing cues. I always think of this. When I think of cues, I'm thinking more of, if you've ever done jigsaw puzzles. Me and my mom would love to do jigsaw puzzles. And that's when you would take the pieces of a puzzle and you will put them together. And so many times, as our patients present to us, they're giving us those pieces. And it's up to us to try to make those pieces fit together such that we will have a clearer picture of what needs to be done for that particular patient. So when we're talking about analyzing those cues, we are thinking of organizing and linking similar cues together such that you're not scattered with, say, 100 pieces, and you might be able to drill down to 10 pieces that may be useful to you coming up with a plan of care for this particular patient. You also need to think about what other information would help establish the significance of these cues. So sometimes people don't tell you everything. So if a person says, "Oh no, I do fine. I eat vegetables. My diet is good." This is their 24-hour recall, and you see that they're 300 pounds. More than likely, they're not telling you the full story. Okay, so we have to analyze the cues, which also includes what the person is telling us, as well as what we can actually see ourselves, and recognize what cues are important, what information is relevant or not, because all information that a person gives you is not relevant. And you will find that people are going to tell you a whole story. Oh, and the dog went down the street and they caught the ball and then I fell. The dog catching the ball is not important to you, but the fact that they fell is important to you. And so you need to be able to discriminate what is important or not. And we call that recognizing cues. So with that, we determine what is of immediate concern, what's most important, what's relevant versus what's irrelevant. Our next step is going to be to come up with a plan and generate solutions. And again, you must include your patient. Don't come up with a plan that satisfies something just for you or just to be on paper that you're able to say, "Oh, patient verbalized understanding," if that patient is not in agreement with that plan, because it's going to be useless. Okay, so you must prioritize things. You must come up with a plan that works in conjunction with what your patient wants. So again, another example, think about this. Person has an elevated blood glucose, meaning that they have uncontrolled diabetes possibly. Then the plan might be to get their levels down within a certain range. Say you want their range between 100 and 200. And you want to give them a time limit on it. It's not endless. You want to say, by the time you see your doctor again in 30 days, we want your blood sugar between 100 and 200. And then they have something more to work with, something a little more specific. And when people agree to specific instructions, they tend to be more compliant. So you want to be able to include them in the plan and come up with goals that are also achievable. Your fifth stage is taking action, and that means those are all the things you're going to do in order to make that plan be effective. So again, be it medications or teaching should always be inclusive of any plan that you come with, and anything else that the provider might have suggested. So this is what's going to happen typically around the time that you're getting this person prepared for discharge, which, remember, starts at the time that the person is admitted. These insurance companies, they're not playing with y'all. Those people are not going to lay in that bed for day after day after day. No, they want things done within a specified period of time. And our last step that we need to think about is any action that we do, we have to evaluate whether or not that was effective or not. Because if it wasn't effective, that person comes back to you, say in 30 days, and their blood sugar is still 300, something didn't go right. So then the instructions, the implementation of the plan has to change in order that that patient may be able to meet what those new goals are. So it's always a work in process. These skills that you develop, if you use them consistently, will 90% of the time help you get the answer correctly, because what should happen is you should be able to eliminate those answers that are a distraction and determine down, at least get to the point where you got two answers left and you have a 50% chance of getting the question correct. So those are some 6 steps to success on your midterms. And of course, you need to study. I would also suggest to you to look at the objectives at the beginning of every chapter and see if you can answer questions associated with those objectives, because usually your professors will try to make certain that they're able to meet the objectives of learning when they're actually testing whether or not you were able to retain the information or not. So that's it for now. I wish you well on your midterms. Drop me a line, let me know how it went, and also give me some ideas for some additional topics if you're struggling in some area, because if I can't answer them, I certainly can get another nursing professor to be a guest and be able to answer those questions. So good luck. I will talk to you all soon.